Madison Clinic for Pediatric Diabetes has been established a couple of years ago here at UCSF. I think it's a really fantastic development. They have really taken it to the next level. They have almost doubled the number of patients. They're looking at type 1 diabetic patients, and they're doing a fantastic job in bringing in new patients as well as taking care of the ones they have been seeing. They also interact a lot with the basic science here at UCSF, so it's a really fantastic new development.
What I saw here at UCSF is the basic science program, which is really one of the best in the world in the Diabetes Center, and then the clinical and translational research program headed by my colleague and friend Steve Gittleman, which is one of the best in the world, and he's really one of the world experts in this field and doing some awesome stuff. And what I wanted to do is to build an equally great clinical program where kids with diabetes get their care. And that's the vision I had. And then when I shared that vision with this grateful family, they saw that immediately and they were inspired, and we worked together on developing a plan for it, and they provided the funding for it, and this is how it started.
This place just really felt like a home, and I saw that with the patients too. They often come to me afterwards just saying how they really appreciated everything that we did here. They just seem happy out in the waiting room, just kind of doing their own thing, playing and coloring, and then when they walk in and see the providers, it's like they're carrying on a conversation with old friends. It's not like your traditional doctor-patient interactions. I just feel like everybody's just continuing where they left off from the last time that they came in.
One of the programs that we are very proud of in the Madison Clinic here is the transition program. This is a curriculum that we developed to help the teenagers gradually get comfortable and more confident and competent in taking care of their diabetes on their own, transitioning them from the parent doing all of the work to the patient doing all of the work when they are independent and going to college.
Madison Clinic really gives the opportunity to speak with the other researchers on different campuses and in the laboratory to understand what the pathogenesis of type 1 diabetes is about and where these new connections are being made and what that means for the future of diabetes care.
One approach that we're really excited about now, and that's using regulatory T cells. So the idea for this is we've conducted a number of studies over the past 10 or 20 years using different drugs, and we've tried to understand the mechanism whereby they might work. And one of the common themes is these drugs help get rid of autoreactive T cells, the cells that infiltrate and destroy the beta cells. But we've also noticed that they help stabilize or increase a population of T cells called regulatory T cells, which we think of as kind of the master policeman of the immune system. And so the idea was, instead of suffering through some of the problems with the drugs, some of the safety tolerability issues, couldn't we isolate those regulatory cells and expand them up and give them back as a therapy themselves and just bypass the drugs? We can take a unit of blood from an affected patient, purify that small percent of cells that are regulatory T cells, and then expand them 500 to 1,000-fold in the course of 2 weeks.
I think the Madison Clinic is unique in a way that they have a comprehensive view of how they interact with patients. They really put the patient first. It's really hard in this country to get enough support and reimbursements for endocrinologists. They have recognized that, and they say, we don't really care about this. We would like to ensure that our patients are being taken care of and that they do as well as they potentially could do. And I think this is an approach that is really inspiring and something that we absolutely support here at UCSF.
The Madison Clinic has now become one of the major pediatric diabetes centers in the country. I think we built a model that many people look at and wish to do the same. But we're not done yet. I think we've got a lot more work to do. We would really like to expand our work and scale it and develop more programs here in our clinic.